any questions, put onto Slido, please. And I'd like to invite Professor Susan Shenkin to talk about ENRICH Scotland.
Didn't read the instructions. The site's got the steps for the future. So it's really lovely to be here and to see such a full room with such a diverse audience.
Susan Shenkin.
I'm talking today about ENRICH Scotland, which has developed as a partnership really with the Neuroprogressive and Dementia Research Network. And I think, as Rosie was pointing out, it really highlights the importance of us working together. This is looking at enabling research in care homes. And anybody who lives with or knows somebody who's lived with a neuroprogressive disease or with dementia knows that considering whether you may end up at requiring care home or other care in the future is a big part of what you may be worrying about as part of that condition or thinking about or considering. And part of this work is bringing these groups together to think about these aspects more broadly. Is there a clicker? Here it is. Thank you. So we'll just start with this video that Rosie mentioned, which was recorded in Fife on a beautiful sunny day, and you'll see a little bit about what ENRICH Scotland's all about.
Welcome to Raith Manor. This is just one of over 1,000 care homes in Scotland who are leading the way in research.
Ellen's working it out here.
Welcome to Raith Manor. This is just one of over...
Again. And Kirsty in the back, who recorded this, is absolutely cringing right now. Just wave at Kirsty.
To Raith Manor. This is just one of over 1,000 care homes in Scotland who are leading the way in research, supported by ENRICH Scotland, enabling research in care homes. We promote and support research.
Try that again. And at Raith Manor, an advert for Raith Manor, a fantastic care home in Fife, Abbotsford Care, where we took this, where we recorded that. You going to try again? It's all going so well.
To Raith Manor. This is just one of over 1,000 care homes in Scotland who are leading the way in research, supported by ENRICH Scotland, enabling research in care homes. We promote and support research in partnership with care homes across the country. We're working together towards the goal of improving the lives of residents, their families, and the dedicated staff who care for them. Research plays a crucial role in identifying best practices and putting them into place to provide the best possible care. By understanding the unique needs of care home residents and staff, we can make informed decisions that lead to positive change.
It's just about improving the quality of the residents, the staff and the relatives' journey through care. Just making it more accessible for people, finding out what works, what doesn't work. But it's just about involving everybody.
I came here just after Christmas. I enjoyed it. I was looking forward to it to begin with. My daughter got it arranged. But it's been great.
I like it here. People are very friendly. Staff are good.
You get a laugh with them, and you get a laugh at us.
I think research is important for better quality of life of the residents, getting them to experience more things, getting relatives more involved, and finding out that residents like something that they didn't even know they were interested in. In my head, research in a care home would be just sitting, having a chat, having a cup of tea, having a cake.
Residents coming into here could be quite stressful, so you might want to know a bit of background about these residents, things they've done at home, their past hobbies, jobs that they used to do, little things that can help them settle into the care home as well.
The research I would like to see for the future is more around how we can make the transition from home to a care home setting a little bit better. To help us do research in care homes, it's just about communicating with us. We're very willing to take part in any research that you have going on. If we can help, we will.
As you can see, research in care homes is simple to take part in and makes positive change happen. There are opportunities for everyone, residents, families and staff. We at ENRICH Scotland will continue to work to make a lasting impact together.
Great. thanks for sorting that out and get back into the slideshow. So I hope that's given you a bit of a flavour of what we're trying to do in ENRICH Scotland. It's very much about working with the care homes to do what works for them and trying to demystify this idea of what research is, as Rosie was talking about before, that it's very much, it can be sitting, having a cup of tea, having a cake, talking about things, or it can be doing a randomised control of drugs, which is quite difficult to deliver in a care home setting, and we're working on that. So just giving you that diversity of experience, but just trying to make it easier for everybody. So who are we? Well, Emma and I share Emma has so many hats on, but today, as well as her role in the NDN, but she co-chairs ENRICH Scotland with me. We have a senior team supporting the research involving Irina, who is our health and social care lead with a strong voice from social care. She's a social worker. Rosie and Anna work very strongly in the PPI work. Maria is our senior clinical studies officer, supervising this team of support officers who cover the whole of Scotland. Relatively small amounts of time at the moment, but there is somebody who can support care home research in every area in Scotland now. And Helen, obviously our expert administrator and tech support and all-round fixing person. So what do? We bring together care home staff, residents and researchers to design and deliver research to improve quality of life for residents, their families and the staff who care for them. And we're involved with all these different parts of work with rich voices very much at the heart and centre of all we do. I'll talk about that in a second. Rosie's explained that to you already, and that QR code will take you to the video that you saw. But they are very core to what we... Helen's doing the slides for me. My timing's not exactly what I wanted, but that's fine. So you've heard that from Rosie anyway. So we have research-ready care homes, which are homes that have signed up to say that they are research-ready. It doesn't actually mean that they have any research experience, but it means that they're willing and able to hear about the research studies that we're doing and to consider taking part. That's over 330 now in Scotland. It's over almost a third of all the care homes in Scotland have signed up, which is remarkable. And it's great to have this resource. And you see these certificates. These were endorsed by the Care Inspectorate. And the care homes are very proud of having these on their walls to show that they are enthusiastic and willing to be part of this research. And now we just need research for them all to take part in, because there's no point in having these people all involved and interested without something for them to do. It's spread across the whole of Scotland, although some places are better represented than others. And we've moved into the Western Isles now, so that's all good. Trying to broaden out that involvement. Another key part of ENRICH Scotland is the care home innovation partnerships. And this is a really exciting part of what we do, which is underneath the umbrella of ENRICH now. We work with these groups of care home managers. We have a group in Edinburgh and one in Glasgow. The Edinburgh group is 6 privately owned care homes, some for-profit, some not-for-profit, with a variety of larger ones and smaller ones, whereas the Glasgow ones are all health and social care partnership homes. So we have a diversity of homes that are interested in hearing about innovations that are going on and partnering with us to develop those ideas. And they are some of the first people that hear what's going on, they test them out, they give us feedback, and they learn from that and we learn from them. So these are really great resources for any ideas that external people have for testing them out and for developing ideas and bringing them to researchers. So that's a really great forum for dissemination and engagement in research. The Care Home Managers Research Forum is a place where we can share research and evidence with care home managers who come along online to hear about the newest things that are going on and to give their feedback and ask questions of researchers. And we're also using that sometimes to co-create ideas and to get feedback to iterate ideas as things are developed. And that's an ongoing piece of work that's going on every 2 months. And for several years now, we've had a Care Home Researchers Forum where researchers from all across Scotland, from a wide range of specialties. I'm a geriatrician, there are doctors on the team, there are nurses, social scientists, social workers, as well as people who work in the social care sector themselves. And in this forum, the researchers get together to share their experiences, knowledge, and to try and learn from each other to do things for the future. And it really helps us to make sure that we don't do the same thing as somebody in another university down the road is doing, but that we work together to do better research for the future. These are just some of the studies that ENRICH Scotland's been involved with. It was really just to say that a big part of what we're doing now is thinking about the prioritisation for research activities for care homes for the future. There are so many things we could do that we've actually gone out to care homes to ask them, what do you think are the important areas that we need to look at, and how can we work together to make sure that they are prioritised rather than what researchers think are prioritised. And we've done some of that work ourselves, and we've also linked in with a team from Leeds University who did a piece of work including going into the care home and talking to the residents and the staff and the families about what they thought was important for research for the future. We've had some very specific studies which are mostly involved interviews, questionnaires, and that sort of methodology, but we're also interested in a wider range of techniques. And it's not just about studies that focus on care homes and the people who live in them, the majority of whom, as you know, will have dementia. But we've actually also tried to open out care homes as a place where you can take part in any study that may or may not be relevant to that. So, for example, this study was looking at the drug use of older people in the UK. We said, well, why should people in care homes not be able to answer this study if they want to? So any study can be open to people in care homes if they want to be. So our future work is going to be shaped by this prioritisation exercise, very much so, but many of the things that we're looking at also have come out from some of the initial things that care homes have told us they think are important. I was talking to Stephen earlier about people's data and the fact that it's your data and you should know how it's used. Well, when you're in a care home, a lot of the information that's collected about you for your personal care is very valuable and important. Could we think about how we can share that in a way that will help everybody to improve your health and care in that care home? So that's a big piece of work that's going on just now. Very important research about recruitment and retention of staff, which is critical for the future now. We're looking at how we can deliver clinical trials in care homes and have put in a grant proposal about testing the new RSV vaccine. And we want to understand better how to understand research and co-create ideas with staff in care homes. And another crucial piece of work, which is interesting for geeky researchers, but probably less interesting for other people, is to try and make the ethical and governance frameworks around what happens in social care as easy to navigate as it is in the NHS. The people who know how easy it is to navigate in the NHS can, maybe that's not a good thing, but at least you know what you're supposed to do. In social care, it's a little bit more complicated at the moment, so we're trying to help with that. We've had some really lovely feedback from some of the initial things that we've done. This was a researcher from Leeds saying how brilliant the clinical support officer, studies officers have been in helping to recruit to their study. And for the residents themselves, there's loads of benefits of taking part in research. As you can imagine, it identifies areas that they're concerned about, and we can see them as research partners and not as subjects of research. Early access to treatments might improve outcomes and could lead to improved quality of life. And of course, taking part in a study may have social benefits, increase interaction, and it gives people a purpose and hope for the future, I hope. So we've also had some lovely feedback from staff and residents of care homes just saying about how engaging in research has made a difference to them and made them feel like they're contributing, and that they valued the fact that that people came in and talked to them and didn't just fill in a form, which I think is an important feedback for us to think about. And also the value to the care homes of having this recognition from the Care Inspectorate of taking part. So I've talked at you for quite a while, so just take a think for a moment yourselves. I think there's nothing like the experience of dementia and care homes to allow people to think personally about where they sit with these questions, because it's something we all have experience of one way or another. So how are you involved in this? How could ENRICH Scotland and the NDN help you in a personal or a professional capacity, your staff, your family, your friends? Let's think about the future. If you were a care home resident, what would you want? Would you want to take part in research? How can we make that happen for you? What's the way that we sort out the paperwork to make sure that your future wishes are respected when you're in that situation? And then what topics and research methods are you most interested in and why? What would you like us to be looking into? And those of you that are staying for tomorrow, Terry and I are going to run a session where we look at possible research questions and how we could answer them. So you can start thinking about that now. But my take-home message is, think care home research, think ENRICH. We want to be the one-stop shop. If you're thinking about it, come and ask us and we'll try and help and make sure we're not duplicating, we're all speaking the same language, we're all trying to do the same thing. Thanks very much.